You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker. I'm the owner and founder here at Good Life Family Chiropractic here on the south side of Lincoln, coming to you every weekday morning at 9:30 here on KCRO 660 AM out of Omaha and 106.7 FM here in Lincoln. And I wanted to come to you today. I know for some of you that follow along closely, the last couple of episodes have been replays from previous weeks or months. And there's a really good reason for that. And that's because last week, my baby, Zeke, he had a severe subluxation reaction, unfortunately. His sister had kicked him in the head on Wednesday morning. And when he went down for his nap at daycare, he stopped breathing. And he was resuscitated, immediately started seizing. They transported him here in Lincoln to St. E's. And that's when I got there. They called me as soon as all this started, and I dropped everything, ran over there, and got to see the tail end of his seizure. And when I got there, he was struggling to breathe. He was pretty much flailing his arms uncontrollably, shaking. And it was one of the scariest moments of my life. My mom always talked about, and actually she didn't, but when she's talked about the breathing issues that I had, I could really only just imagine what that would be like if I had a kid that went through that. But I got to see it and I got to experience it. And I am still, even right now, dealing with the hormonal and stress response to seeing your baby struggling to stay alive. Now, fortunately, I'm trained the way I'm trained, and I went to him. I held him. I began to comfort him and pray over him, and I put my hands on his neck, just like I'm trained to do with every patient. And I felt his spine. And the top bone in his neck, it was shoved over to the side. Now, at that point, I did not realize that his sister had kicked him in the head. I didn't even know what the mechanism of injury was. I just knew that if he was subluxated, if his spine was out of alignment, then he was not going to have as good a chance to survive this as if it was in alignment. And I adjusted him. And as I adjusted him, just like what happened with my niece and my nephew and every single baby I've ever adjusted, his body began to relax. In his case, his breathing started to normalize immediately. His arm started to calm down and come back to his side, and his movements became much more normal. And after about 5 minutes of just massaging his neck, basically pushing that vertebra back into place, he calmed down enough that I was able to hand him to my wife, and she was able to nurse him, and he breastfed and he fell asleep, and he was on all these monitors. And from that moment on, every single test result we've had has come back normal. And we were very concerned. At any time I put my hands on someone, I'm never 100% sure if the misalignment that I'm finding in your spines are a result of the stress that you're feeling, the traumas that you've been through, or if they're causing the stress and causing the traumas. But in his case, over the next 3 days, we ran a CT scan, we ran an EEG, we ran chest x-rays, we ran blood panels, we did an MRI, we did a spinal tap, all in the name of finding the cause. And every single one of those tests came back with a negative result, an answer to our prayers, really. Because all of those things, they check for the worst things in the world. They check for things that'll kill you. They check for things that'll create more seizures. They'll check for things that in a moment are absolutely necessary to deal with an emergency and deal with a crisis. But in that moment, when I adjusted his spine, I addressed the cause. Number one, I addressed the system that controls all function in his body. And in his case, what was keeping him from taking a breath normally and keeping his brain from functioning normally. And, I thank God for all of the emergency workers, the the people that arrived, the daycare worker who was trained to do infant CPR and keep my son alive when he quit breathing. Thank God for the EMTs and just getting him to the hospital safely, and the emergency room doctor at St. E's, and all the nursing staff and all their training. But it is so amazing that God would choose me to be Ezekiel's dad so that I would be in that emergency room in a system that completely ignores the central nervous system until there's a neurological symptom, that ignored his spine in spite of my telling them over and over that his reaction to me even touching his neck was one of pain. They'd never once checked his spine. And ultimately, we've been able to deem that that was the cause. That his sister kicking him in the head, it knocked one of the vertebrae loose. The top bone in his neck, atlas, that surrounds and protects his brainstem, was shoved over to the side. Enough that when he laid his head down to sleep, and he rolled himself over into a tummy position, and then when he did that, it knocked that vertebra out just enough that he squawked and he quit breathing, because it put enough pressure on the respiratory center and the respiratory nerves that exit the brainstem right at the top level that he quit breathing immediately. And he was non-responsive until he was stimulated enough that that vagus nerve and those respiratory nerves kicked in. And it wasn't until we adjusted him that his body began to heal the way that it's designed to heal. And now more than ever, I've always been convinced that every baby needs to have their spine checked. And a lot of it because of my story. And if you haven't heard my story, it reads exactly like Ezekiel's, except just more drawn out, a longer process. My mom went through the exact same thing with me, except at 2 weeks old, the day of my first well check, the day she brought me home from that well check with a clean bill of health, I quit breathing for the first time while I was breastfeeding. She reminded me of this weekend. And she said, you were looking at me as you were turning blue with fear in your eyes, just begging me to help you. And there was nothing I could do. And, in a lot of ways, I felt that same thing. He was so helpless, except I knew there was something I could do. I checked his spine. I found the misalignment. I fixed it, and I fixed it 20 times over the weekend. I adjusted him over and over and over again. And each time he got better. Each time the test didn't just get more normal, he got more normal. The only comment I got from the doctors all weekend was how healthy he appeared, how far ahead of all his milestones he was scoring, how not just his size and his weight, but just his development, his motor skills, his verbal skills, his control, his interest in color, his interest in people, his facial expressions, his intelligence. It was just constant. And these are from doctors that are seeing problems like this every single day, but they weren't trained in how to evaluate the central nervous system properly. And this is the top neurologist in the world. The Children's Hospital in Omaha is one of the best hospitals in the world, ranked by the U.S. News and World Report, and they didn't even look at his spine, even though his parents were telling them that his sister kicked him in the head. They said, no, the CT scan is fine. The MRI of his head is fine. There's no reason for him to have responded this way. There's nothing wrong with his spinal tap. The cerebrospinal fluid is coming up clear. The blood cultures are coming up clear. There's nothing. And they still wanted to treat him. They wanted to give him an antibiotic. They wanted to give him an antiviral, even though there was no sign or symptom of a virus or bacteria in his body or in his blood or in his cerebrospinal fluid. They just wanted to cover their bases. But when you get to the cause, you don't have to live in fear. And that's something I keep telling myself over and over as I check his spine multiple times a day. But it's why I recommend that every single child visit a pediatric chiropractor, someone who's been trained like me, who's had classes and taken continuing education hours on how to properly care for a children's spine. Just how to avoid some of these stresses, but also how to correct some of the misalignments that start to create issues. And yes, for most of you and most of your kids, it won't be a breathing issue like Ezekiel. But for most of you, it will be something that's going to lead to health problems down the line. For my wife, her signs of subluxation as a baby were colic. She never slept. She hardly ever let her mom sleep. It was just constant crying and reflux and all this stuff that now they would have put her on a medication for, but when we look at her spine, we can see evidence of damage from as early as birth that put pressure on the nerves going to her digestive system. For some kids, it'll show up as asthma, an autoimmune response in the lungs that creates episodes where they have difficulty breathing. My oldest, Dietrich, every time he's subluxated, he goes cross-eyed. And he had an eye exam while this was happening one day. And they said that he would have to go get physical therapy for this. But every time I adjust his neck, he says, Dad, I go from double vision back to normal vision. It's a misalignment at the top of the neck. And that lasts and that holds. And it holds for weeks at a time in his case, until he gets kicked in the head, until he stumbles down the stairs or trips and falls down the stairs, until he falls off a trampoline or stands up, and because he's a little taller, he bumps his head on something that wasn't something he would have hurt himself on the time before. Our kids need to be checked at birth. Our kids need to be checked all the time. And for Zeke, I'm going to overcheck him, not over adjust him. I'm going to adjust him when it's needed. For Dietrich, I'm going to check him every single day after school and make sure that we're keeping him in alignment so he doesn't end up with that double vision. With Annika, just all the time. Why? Because every child deserves to be able to express life to the full. So if your children aren't dealing with life to the full, reach out to us. You can go to our website, goodlifefamilychiropractic.com. You can go, and look us up there. All of my contact information is on the website. You can also find us on Facebook, facebook.com/AskDrJake. As I record these shows, I'm recording them in video as well so that you can tune in and you can see just what's going on behind the scenes, behind my eyes, and just how much this breaks my heart that my kids, yes, they're having to deal with some of the ramifications of a misaligned spine, but they have the blessing of having a dad as a chiropractor, someone who's going to look and make sure that their central nervous system is healing and functioning 100% all the time as much as possible so that they can express the fullness of their potential, so that they never have to worry about a misaligned spine putting damaging pressure on their spinal cord or interfering with the expression of life across their nerve roots or out to every organ, cell, and tissue in their body. Not so that they don't have symptoms, but so that they can express life to the full. Like Jesus said in John 10:10, I have come that you may have life and have it to the full. In Jeremiah 29:11, he says, I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you hope and a future. And who is that more for than our kids? And so you can call us if you want an appointment this week. It's a short week for me where I'm traveling to my sister's wedding at the end of the week. And so we have limited appointment times available, but you can call and you can take one of those. But don't make an appointment unless you're serious about coming in and serious about making sure that you and your children and your family are living to the fullness of their potential, the fullness of life, because that's what we want for you. I'll be back again tomorrow for another episode of Ask Dr. Jake.